I personally have seen a pretty significant shift in the buy-in and a cultural buy-in from officers and staff within the facility recently. When we first started talking about bringing all three forms of MOUD into our facility, there was hesitation is probably the best way to put it. But there has been, I believe, a very significant cultural shift where instead of looking at individuals who are suffering from substance use disorder are no longer treated as these stigmatizing words of junkie or this or that. It has turned into patience and care and treatment over these people are making bad decisions, bad choices, and it's really heartening to see that change and that shift in culture. When we first started medication for opioid use disorder back in 2014 here in Middlesex, we were only offering one form. It was the extended release injectable naltrexone, and there was a lot of education that was required to get folks to at least understand what it was, and not just for the inmate population. It really existed for everybody. It existed for parole and probation. It existed for officers and staff, because everybody thought that it was replacing one drug with another drug, right? That was the thought process. And now, with all three forms of MOUD available, there has been a lot of buy-in from folks. We're dosing 110 individuals per day on any one of the three forms of MOUD, but it's taken all that time to try and convince folks that this is a program that is meant to save lives. It is meant to reduce a disease and treat a disease, and it's not a way of replacing one drug with another drug. And I do think that the education has been successful in getting that population. We have seen, an exponential rise in the number of doses per day that are being given out.
Patients who end up in a jail setting are highly incentivized toward the medication because this is the first medical appointment these individuals may have had in years or their life. And the experience of withdrawal from opioids is hellish. It's complete agony. And it's terrible to witness. So they're highly incentivized toward that medication. They may be in our jail for a very short period of time. So it's an amazing amount of reentry work to be done, behavioral health work, medical work, and then continuity of care planning for them. But I think that the individuals see this as a big support, and stigma is still an issue, right? It's still an issue of is this just replacing one drug for another? And it's not just that. It's a whole intervention. And so it's important to continue providing education and training and making that available multiple times for patients and for our staff.